But please, questions from the audience. See several hands going up here. Do you want to grab that?
Hi, I have a question for Ermias. Oh, sorry? Oh, okay, my name's Lyle Rode. I'm, I guess, a retired ruminant nutritionist. Ermias, you mentioned lipids, and lipids get mentioned a lot, but they all get lumped together as lipids. But we know when we feed dairy cows, the more unsaturated the fat is and the more oxidized the fat is, we know we're having dramatic impacts on the ruminant environment. Do we know how those, like the more unsaturated the fat is, or if it's oxidized fat, does that have an impact on the amount of methane mitigation?
Yeah, so if you look at some of the meta-analysis that was done, you can see that by the source of fat or the source of lipids, there is a slightly different reduction potential that happened. But when we tried to do that in this second-order meta-analysis, we didn't really see that much of a difference between different sources of fat. Maybe that's because we didn't have enough variability within the different sources of fat, but we're not able to detect that significant differences by the source of the fat. At least that was done from the literature.
We'll try to do a few more questions. There's a question over there. Do we have a microphone going around? Okay, for now you have to yell at me. No?
Thank you for sharing the state of the art around feed additives. I'm just curious, Karen, your study actually raises a lot of questions. So as a commercial person, I'm just curious, like, what is the line of sight do we have for a solution in the next 5 years?
Yeah, no, I mean, this is a very good question, but also quite difficult to answer because, I mean, we have the 300p obviously been around, and you know, as Karen mentioned, a lot of countries have approved it in dairy, and then in beef is coming as well. I think they will be applying for beef as well. But others, there's a significant strides that's happening in the seaweed bromoform space. What is needed is really data on toxicity data of the compound itself, on human health, on animal health, and environmental health. So I think that data is being gathered right now. We should have in the next year, I think we should have enough data to be able to say if those compounds are safe. So once that is established, then you need a further year or two to make sure that you know, to start the approval process and all that. So I would think that, you know, maybe in the next 2 to 3 years we can see something on the market on that. The vaccines, well, it was a whole panel here. I don't want to speculate, but I think within 5 years is the optimistic view on that as well. So yeah, there are some on the horizon, but we still have some time to go before it's actually available on the market.
Sorry, just a quick build on this. When I look at connect the dots with the measurement, right? And when you look at the efficacy levels at safe dosage, it is only, let us say, 20, 15, 20%. I think the measurement rate is 10, 20% itself. How do I make any conclusion?
Not sure I understand, but so the efficacy is, are you saying about 20%, 10, 20%? Yeah.
So efficacy at safe.
Well, I think a lot of the safe levels, it depends on what you're looking at. For example, for the bromoform, it's, you know, we have a midpoint or the average of about 30 milligrams per kilogram of dry matter, and at that level, you're going to get around 50% reduction in emissions. So if you go beyond that, obviously you're going to get more, but you have to compromise with the reduction of dry matter intake or anything like that as well. So if you want to keep the dry matter intake, not affect dry matter intake, you will have to compromise with the reduced efficiency as well. So instead of getting 100% or 95%, then you go to about 50%, but at that level, you still have okay in terms of the dry matter intake. So a lot of the stuff that I showed, it's on kind of on average dose, and then you can change that dose. But then when you change that dose, especially to the higher level, then there are some consequences that probably not be desirable.
And just to build on that, when there is so much variability in methane emissions and the efficacy might be in the 15 to 10% range, you're going to need a lot more animals to detect that. And that's when there's more variability, you need more experimental units. And so as those lower effective products, you need to have a lot larger studies. And when you move to pen studies, they need to be replicated as well to account for that variability.
Virginia, there's one more question. Yep.
Hi. So Mallory, I know your answer, but so maybe this question is directed more towards Hermes and Karen. Suppose a dairy company or someone at a dairy company comes to you. Let's say the name of this fictitious person is Anshuman, and they ask you, other than if they ask you, I want to do something in this space, what can I do? If you had to say anything other than give me more money to do research, what would that be?
We have a speechless panel.
Yeah, I think right now we do have quite a number of solutions that needs to be sort of understand much more deeper and then accelerate what questions we are asking and then move on into commercialization. So I think with the Bovaer, for example, it took a long time to get there, a lot of trials to get there, but if there was enough funding available at the time, you could do a lot of those stuff almost at the same time in different locations so you can get enough data to be able to do that. So if you can work together and ask different questions from different people, then you can get all that data collected at a shorter period of time and then apply to a regulatory body, or so you can move the needle a lot faster.
So we have to close this session, but I want to just repeat something that we heard yesterday when we had the regulators talk to us, and that was from the time that the research is done by people like us until it's rolling out into a feed store, quite a few years can go by because safety and efficacy and all of that has to be tested, and it won't be happening chop chop. But there are different types of additives, different types of technologies that have high promise and that will be rolled out in the future. The question is, how much will is there? Political will, regulatory will, industry will, and consumer will and acceptance to getting us there. Please give me, help me to thank our panelists, and thanks everyone.